Welcome back. Hopefully you've been paying attention to my pharmacokinetic lecture. The pharmacodynamic lecture is going to be a lot easier. This is the grass's greener side. The pharmacodynamic portion of pharmacology is still an important high-yield concept, just as important as pharmacokinetics. However, this should be a little easier to understand. At least I think it's a little easier to understand. It makes sense. We'll be dealing with some graphs and some high-yield topics. We'll be talking about Michaelis-Menten dose curves. We'll be talking about Lineweaver-Burk plots. Pharmacodynamics, like I said, is what the drug does to the body. Drug does to body. While the pharmacokinetics was what our body was doing to the drug through like the absorption, metabolism, distribution, and elimination, now we're dealing with what the drug is going to do to the body. We're going to deal with receptors, we're going to deal with enzymes, we're going to deal with fun stuff. So the pharmacodynamics. And to start out this fun lecture, we're going to start with the Michaelis-Menten dose curve. The Michaelis-Menten dose curve. Now, what is so fun about this? This is the backbone to what we'll be talking about today. This is high yield stuff. Why? Because everybody learns this, and they learn it the same way. My goal right now is to get it so you understand where we're coming from, why we see what we see. And if you understand why this stuff happens, then you'll understand what it is a lot easier. So we've got substrate concentration down on the x-axis. We've got velocity of reaction over on the y-axis. Well, what does this mean? Well, we've got substrates. Substrates get converted into products. That should not blow your mind. And to do that, you need an enzyme. That shouldn't blow your mind. Substrates, when they interact with enzymes, you'll get some kind of product. I don't know what that product is. You'll get some kind of product. So this occurs at a set rate. If you have 100 units of substrate and this enzyme is going to work at 100 substrates per minute, and you'll spit out the products, you'll happen at a certain rate. However, if you keep increasing the substrates, so if you get further to the right on this x-axis, as the substrate concentration increases, you're going to get a buildup. This enzyme can only work so fast, and they do a good job. However, eventually you're going to have so much substrate built up that this enzyme is going to get overloaded. It can't keep up with it, so you're going to get a substrate buildup. We can visualize this through the Michaelis-Menten dose curve. And you'll see a line kind of like this, where you'll have the velocity over here kind of start to level out. You'll get a velocity that just flattens. And it's at that velocity where, right there, kind of, if we drew over a little imaginary dotted line, it's where our enzyme gets saturated with substrate. It's working at the most it can work at. This is called the Vmax. The velocity max. It's a velocity at which this enzyme is working at. This enzyme is saturated with substrates. It can't do any more work, and you'll get a work buildup. If you would like another way to think about it, think of it as a worker at a company. That worker can only put in so many hours in a day. They can only do so much in that time. They're working overtime. They're staying as late as they can. They're doing it as fast as they can. But if they keep getting new work, they keep getting more tasks to do, eventually some of those tasks will build up and they're at their maximum efficiency. So what we'll need to do is we'll need to recruit some more workers to help out this worker, this enzyme worker at this company, because they have so many tasks that they're expected to do, but they can't. So what we've got is we're going to recruit more enzymes. We're going to increase the enzyme concentration. We're going to increase the enzyme concentration. And when we do that, we can work more. We can increase our velocity. Our Vmax is going to increase, because if we increase more enzymes, we're going to increase our velocity, so we'll be able to do more work faster. So if we increase enzyme concentration, we'll increase Vmax. Alright, what else do we have? Well, we've got something called the Km. The Km. And what this simply is it's going to be the affinity of the substrate to the enzyme. Now that's important. Affinity of substrate to enzyme. This is one of the harder concepts. The Vmax was pretty straightforward. Enzymes can only work at a certain rate. When it gets saturated with substrate, as the substrate concentration increases, eventually we'll see this Vmax. However, the Km is a little harder to understand. Simply put, if you have an increase in Km and likewise a decrease in Km, if you have an increase in Km, you're going to decrease the affinity. So if you increase the Km, you're going to decrease the affinity. Likewise, if you're going to decrease the Km, then you're going to increase the affinity. So Km deals with the affinity to the substrate of the enzyme. If you have a low Km, you're going to have a high affinity. If you have a high Km, you're going to have a low affinity. So this should probably deals with the mechanics of the affinity of the substrate to the enzyme. So now let's talk about what this is. Well, we look at the Vmax and we say, what is half of the Vmax? So half of the Vmax in this situation is going to be right about there, because we're looking on that y-axis, we're just bisecting it. So on our curve, on our dose curve, it'll be right about there. And then what we do is we draw a little connecty line down there. We try and figure out at what concentration of substrate is half of Vmax. So at what concentration, so our Km is going to be our substrate concentration at 1/2 Vmax. That is going to be our Km. Oops. No, I don't want to erase everything. I want to erase this little line that I drew. Okay. So our Km is dealing with a substrate concentration at which 1/2 of our Vmax is accomplished. It's going to be an inherent substrate characteristic. So if we have a decrease in the Km, we're going to have an increase in affinity. That being said, if our Km is somewhere over here, if we move our Km down the line, it means that we need less substrate to get our enzyme happy, to get our enzyme satisfied. Now, I really should erase some stuff so we have room, but I'm going to leave it all here. What we're going to do, no, I'm going to redraw this, just without the axes. So we've got our lines here, we've got our curve here, and we've got a Km that's at approximately 1/2 of our, oops, it's a little high. This will be 1/2 of our Vmax. So this is our Km right there. Now, like I said, a high Km means a low affinity. What does that mean? It means we're pretty high. I mean, we have a lot of substrate. We have a lot of substrate here. If we move this Km down, if the Km is now here, we need a lot less substrate to reach 1/2 the Vmax. It doesn't take as much substrate to reach the Vmax. It means we're going to have a high affinity. If we decrease the Km, which we just did, we moved the Km down, then it means that you have an increased affinity of your substrate to the enzyme. That's all it means. The Km is an affinity measure. So if I were you, if I was just trying to memorize something, I would memorize this. This is high yield. This is testable information. If you have an increased Km, it means you have a decreased affinity of your substrate to the enzyme, and then vice versa. Okay, and then that's a poor attempt to try and explain that. So now let's take a look at the at another variation to that. It's called the Lineweaver-Burk plot. The Lineweaver-Burk plot. Okay, and what this is it's simply a reciprocal. I think that's how you spell reciprocal. It's a reciprocal of what we just saw. So here's what we just saw. We have our Vmax, we have our Km. Our Km is going to be equal to 1/2 the V. It's going to be our substrate concentration. Not sure what happened there. It's going to be our substrate concentration. So it's going to be our substrate concentration at where our Vmax is divided by 2. It's going to be our half of Vmax and how much substrate we're going to need for that half of Vmax. Let's go back. Okay, so our Lineweaver-Burk plot is going to be reciprocal. What is reciprocal? 1 divided by something. So 1 divided by everything that we just talked about. So let's show what this actually is, because this will show a very good graphical explanation. And this is another place where people get tripped up in the whole system. So my goal is to try and at least make it a little bit clearer. So we've got a line that kind of looks like this, and you're saying, what's going on? Well, let's take a look at our axes first. We've got 1 divided by Vmax. Our y-axis is still our Vmax, nothing has changed. Likewise, we have 1 divided by substrate concentration, nothing has changed. That is still our x-axis. We're still going to have affinity dealing with our substrate concentration, so we'll see affinity. We'll still see our Vmax. This is velocity, my apologies. 1 divided by velocity. We'll still see our Vmax into the picture, but we've got our just reciprocal of everything now. And notice how we kind of go over the y-axis into some negative stuff. So we'll be dealing with a little bit of negatives, but really our goal is to try and make things as simple, so we'll kind of get rid of the negative aspect of this and just deal with kind of the concepts from here. So here's our exact same thing, except now it's a linear line. So over here we're dealing with a curved line. We have Vmax, we still have Km, we have substrate, we have velocity. We're going to deal with the exact same stuff, just in a different format. That's all we're going to deal with. We're going to take a look at where our line crosses the x-axis, and we're also going to take a look at where our line crosses the y-axis. And this is going to be an important concept. So where it crosses the x-axis, this is going to be our 1 divided by a negative Km. Well, what in the heck does that mean? We're negative because we're somewhere on the negative side. So if we get rid of that negative, then we're going to leave it in there because that's the actual equation. However, just remember that this negative is just meaning since we're somewhere over on this negative side, it'll get rid of it. We want a positive Km. A positive Km is normal. And since we're somewhere over here on this negative side, we got to throw in a negative, and that way we'll get a positive Km. Like I said, everything's reciprocal, so that's why we're 1 over something. If you have an x-axis on a Lineweaver-Burk plot, if your reaction crosses the x-axis, that's going to be your Km value. And you can derive that Km value from this equation. Likewise, you'll have a y-intercept. You'll intercept the y-axis at some point. This is going to be your 1 divided by Vmax. Reciprocal of Vmax. Because remember velocity, I'm going to go back. Remember velocity and Vmax are related, while Km and substrate concentration are related. All we're doing is putting it in a different way to look at it. The reciprocal view. Our Vmax and velocity are still connected. Our Km and substrate are still connected. Remember the x-axis was substrate. So everything's normal. Everything's still legitimate. Everything's still normal. Just everything's reciprocal. So here's our normal reaction. Our Vmax can be calculated by the y-intercept. Our Km can be calculated by the x-intercept. We're going to draw this again and take it a little bit further. We've got our normal linear enzyme here. Now, what we're going to do is we're going to introduce some inhibitors. Now, before we get to the pictorial, we're representation, I'm going to talk about these inhibitors. We've got competitive inhibitors, and we've got non-competitive. Now, this is one of the high-yield concepts of pharmacodynamics. I would star this, and I would commit this whole thing to memory. Now, why is this? Well, you've got competitive inhibitor and non-competitive inhibitors. So, inhibitors. I would not mimic my spelling, because that is supposedly saying inhibitors, but you get the point. So these are dealing with inhibitors. Now we're going to inhibit the enzyme, and you can inhibit an enzyme in two different ways. If you've got a Pac-Man enzyme here, where the active site is going to be in the Pac-Man's mouth, here's Pac-Man's eye, you're going to have substrate, you're going to have a triangle-shaped substrates, and they'll fit in the active site. However, if you have a competitive inhibitor, you have something that kind of looks like the substrate, except it's not. This triangle, this is going to be our inhibitor, represented by the red triangle. It's going to fit in the active site, and what it's going to do is it's going to inhibit this enzyme. However, it's not going to permanently bind, however, it'll inhibit it temporarily. We're inhibiting it. It's not able to bind a normal substrate, turn it into its product. This red triangle is going to sit in there for a little bit, and then it'll dissociate, and the Pac-Man will find something else to eat. So, competitive inhibitor. Well, what if we have a non-competitive inhibitor? Well, a non-competitive inhibitor binds somewhere else. It does not look like the substrate. This competitive inhibitor looks like a substrate. It looks like a triangle. However, it's going to inhibit Pac-Man enzyme. A non-competitive inhibitor might bind to Pac-Man's ear, and it may look like a square. It doesn't have to look like the substrate. It'll bind to the non-active site. The active site was Pac-Man's mouth. That's where he normally turns substrate into product. A non-competitive inhibitor will bind to a non-active site location, such as Pac-Man's ear, and that non-competitive inhibitor may look like something completely different than that substrate. It may look like a Tyrannosaurus Rex. It may look like a square. It may look like an air conditioner. I don't even know. It will not look like the substrate. So that's dealing with inhibitors and their shape and their location, because that is an important concept to realize. Now let's talk a little further about competitive inhibitors. Let's talk about their Vmax. Let's talk about their Km. Competitive inhibitors, Vmax, Km. We're also going to deal with the exact same over here, so might as well just get us prepared. Okay, so competitive inhibitors. The Vmax for a competitive inhibitor is not gonna change. So it'll stay the same. Our Km, on the other hand, will increase. Remember when I said the Km increases, the affinity decreases. Then for a non-competitive inhibitor, our Vmax will decrease, while our Km stays the same. Now let's take a look at this. Well, let's take a look at this. We've got our Km. Now our Km is going to stay the same for a non-competitive inhibitor. The active site is still going to be normal. Our active site will still bind that substrate, so we've got our Pac-Man here. It'll still bind that substrate at its active site, and it'll bind it at the exact same rate, except the inhibitor over here, that square, is blocking Pac-Man from actually converting this to product. So our Km is the same, however our Vmax. The Vmax showed the velocity of the reaction. We're not able to create this substrate into product anymore at an efficient rate, since we're non-competitively inhibiting it at a different site. So we're not able to drive that reaction. We're not able to convert this into its products. We're going to decrease the velocity of the reaction. This enzyme can't work as efficiently. However, over here for a competitive inhibitor, get rid of this square there, and let's draw in some more white triangles. stay consistent. What we're doing is our Vmax will stay the same. If we increase our substrates, these substrates, if we put 1,000,000 billion substrates, normal substrates, per one competitive inhibitor, our Vmax will be normal. Our Vmax will be normal because if we have a solution that has 1,000,000 normal substrates, and in that 1,000,000 normal substrates, we put one inhibitor, so it's like a 1,000,000 to 1 ratio, this enzyme, this Pac-Man, will find this normal substrate 1,000,000 times to 1. So it'll typically find a normal substrate, which means it can convert it to product, and the Vmax will be the same. I mean, it'll be 1,000,000th slower. However, the Vmax will approximately be the same. If we do a non-competitive inhibitor, since we have a square binding in an off-site, this square is actually causing Pac-Man to be inefficient. It's not an active site problem. So we could put 1,000,000 normal substrates with only one non-competitive inhibitor on this enzyme. But what that means is that this doesn't matter if it's binding to a normal substrate or not, it will not work. So we could put 1,000,000 normal substrates on this Pac-Man and it'll still not work. So that's why our Vmax is lower. Our Vmax is the same in competitive inhibitors because if we flood this enzyme with normal substrate, which is not the red triangle, with normal white triangles, our Vmax will be the same. I say it's increased in Km because Km is the binding binding affinity. You're going to decrease the binding affinity. An increased Km means a decreased affinity. We already covered that. That's something that you really should commit to memory because it affects inhibitors as well. So if you increase the Km, you're going to decrease the affinity of this enzyme because what we're doing is every so often it'll eat a red triangle, which will mean it's not as effective, which means its Vmax doesn't get reached higher. We'll have to increase the substrate concentration to reach that half Vmax than normal. Okay, so that's the difference between inhibitors. We have the competitive and we have non-competitive inhibitors. Here's our normal reaction that we just saw. The Lineweaver-Burk plot, this is our normal reaction that we just saw. Now let's introduce an inhibitor to the concentration. So this is with our enzyme and our substrates. So this is substrate divided by 1 divided by velocity, and we have our normal enzyme. We have our normal enzyme, we have substrates. This is exactly what we were looking at before, just the reciprocals. But now we're going to introduce some inhibitors. We have the competitive and the non-competitive. That competitive will be at the active site, it'll be at the Pac-Man's mouth. The non-competitive will bind somewhere else, and it'll block Pac-Man from working at a different site. So we've got two different representations. We've got non-competitive inhibitors and competitive. Now, I'm going to just draw them in. Ooh, this is bad. I can't draw a straight line, but that's close enough. That'll be one of our inhibitors, and then we'll also have another one, and I'll show you, I'll talk through it, and I'll show you how you can kind of like quickly figure it out. So, here is going to be our two competitive, or our two inhibitors. One will be competitive, one will be non-competitive. How do we figure out which one is which? Well, let's take a look back here. I've already said that for competitive inhibitors, the Vmax will stay the same. Now let's take a look. Which one has the Vmax stay the same? Well, we got to think about what is the Vmax. The Vmax is going to be the y-intercept. Now that should be closely together. Now, over here, our Vmax was this y-intercept. We have a normal enzyme, and we have an inhibitor enzyme representation. Our Vmax is right here, and you can tell that this inhibitor plus this normal enzyme share the same Vmax. The same Vmax. So if they have the same Vmax, we know that's a competitive inhibitor. They're going to cross. These lines will cross. They'll competitively cross. If you have competition, you like to work, you like to cross, you like to compete. So these are going to cross each other. If you don't like to compete, your lines are not going to cross. You like to stay your own separate ways. So this will be the non-competitive. So the non-competitive inhibitor. Okay, so let's explain this. The non-competitive inhibitor seems to have the same Km as our normal. Because remember, Km was the x-intercept. Remember, the x-intercept, that is 1 divided by a negative Km. That negative simply just means we're on the negative axis now. So you don't even have to worry about that negative. Everything's reciprocal, so you can pretty much pretend that this reciprocal is gone because everything's reciprocal. So when we're here, we have the same Km. The non-competitive and the normal enzyme have the same Km. Well, here, does that make sense? Non-competitive, Km, same. Check mark, bingo, we're good. Okay, so for non-competitive inhibitor, our Vmax is decreased. Wait, what the? Our Vmax is increased. What? Well, you got to remember, we're taking the reciprocal. So we're looking at this non-competitive, we're looking at its x-intercept, or that y-intercept, because that y-intercept will say the Vmax. Since it looks like the Vmax is increasing, but oh wait, it's a reciprocal. If we have 1 divided by Vmax, if we have a high Vmax, so let's say 1 divided by 20, that's a low number, and then 1 divided by 0.5. 2, and this is what, 0.05. So if we have an increased Vmax over here, or if we have an increased Vmax on here, we're going to have a low velocity. Does that make sense? Since we're taking a reciprocal, we got to take into account that reciprocal. If we have an increased Vmax, we'll have a rate there, and if we have a decreased Vmax, we'll have a rate there. It's because it looks like our Vmax is decreasing. Our Vmax is decreasing. Our Vmax is decreasing. But it looks like it's increasing. Why is it decreasing? It's because it's a reciprocal. Just remember that. So here, let's say this normal value right there is going to be a normal value is going to be 1. Let's say 1. That'll make sense. For a normal enzyme, our Vmax is going to be 1. 1. The velocity is going to be 1 for a normal. Over here, we bump it up to 20. So for our Vmax to be 1, our velocity is going to be 1. For a non-competitive inhibitor, somehow we bumped it up so that way when we cross the y-intercept, we're at 20. So 1 divided by 20 is 0.5. Our reaction slows down. Our velocity slows down. I think that explains it a little better than I was before. Okay, so now let's talk about the Km. Now let's talk about competitive inhibitors. Competitive inhibitors have the same Vmax. However, you take a look here, and you take a look, our x-intercept changed. Here's our normal x-intercept, and that's where the non-competitive inhibitor binds. Our Km just got smaller. Our Km got smaller. So dealing without negatives, we're going to get rid of the negatives because in that equation, so 1 divided by Km, since we have a negative x-intercept and we have that negative here, we're just going to get rid of those negatives because that'll get rid of some of the confusion. So if we have a competitive inhibitor, we increase the Km. But wait a second. We increase the Km, we're decreasing the Km. We're getting smaller down here. This is like -5. This is like -1. How are we increasing the Km? Well, you remember it's the same concept. We're dealing with a reciprocal. So if we have a competitive inhibitor and we're at -1, we'll just say we're at 1 since we're getting rid of that negative over here. We'll say we're at 5 since we're getting rid of that negative over here. Same difference. Or we could just deal with the double negative and cancel out. So our Km is 1 over here. Well, 1 divided by 1 is 1. And over here, 1 divided by 5 is 5. Well, why is that? Well, remember, let's go the correct direction. If we increase the Km, I didn't do my math right. If I did my math right, you would be on the same page, 0.2. If we have a smaller x-intercept, that'll give us a larger Km value once we do the 1 over. Once we take the reciprocal of it, 1 is greater than 0.2. A high Km is a low affinity. A low Km, so 0.2 is smaller than 1, so a low Km is going to be a high affinity. That is an important concept. Remember I said you needed to commit it to memory? You need to commit it to memory, because we'll see it over and over and over. So for a competitive inhibitor, it looks like it's getting smaller. This Km is getting smaller. However, you need to remember that it's a reciprocal. A Lineweaver-Burk plot is dealing with reciprocals, and when the denominator, the bottom, is getting smaller, you're dividing by a smaller number, which means you'll actually get a larger number. Likewise for this Vmax, it looks like our Vmax is increasing. Looks like our enzyme is getting more efficient. But that doesn't make sense because we're inhibiting it. We're using a non-competitive inhibitor that'll decrease the Vmax. And it looks like we're increasing the Vmax, however, it's a reciprocal. So if it looks like we're increasing it, it's really decreasing it. That's about the bottom line. I've beat this to a pulp. Hopefully you understand this concept a little better now. You might need to listen to it again. You might need to listen to somebody else say it. However, this should help you at least begin to realize. Okay, now we need to talk about another concept, and it's going to be potency versus efficiency. Potency versus efficiency. Okay, potency. What does potency mean? It means how much drug is going to be required to get a desired effect. So how much drug, and you can say how much drug concentration is required for a certain effect. And that effect could be pain management. That effect could be heartburn relief. That effect could be anticoagulation. How much drug is required for that effect? Now let's talk about pain management, because that's pretty simple. If you only need 0.5 grams of a drug to get pain relief, so you have a bum knee, you have a knee that hurts, it only takes 0.5 of drug X to relieve that pain. Let's say it takes 100 grams of drug Y to relieve your knee pain. So which drug is more potent? Well, it takes less drug X to relieve your pain, which means this drug is going to be more potent. However, if it takes a whole bunch of drug to relieve that pain, this is going to be less potent if they work through the same mechanism, etc. That's just an example. So now let's talk about efficiency. Efficiency is going to be the maximal effect of the drug. Is the drug going to be super effective? It doesn't matter how much drug. You could give a million billion units of the drug, but it still won't relieve all the pain. So now let's try and tie this together. Efficiency. So you've got pain, and you've got a pain scale of 0 to 10. A pain scale of 0 to 10. You really hurt your knee, and we're trying to figure out which drug is more efficient. We've got two drugs. We've got drug X and we've got drug Y. Now, 0 is going to be no pain. and 10 is going to be extreme pain. So we're trying to figure out which drug is more efficient. So we're going to give, so drug X, its best concentration is going to be at 100 grams. Drug Y will also be the same. They have the same potency. They're both going to take the same amount of drug to exert their effects. So it doesn't matter if you give 100 grams or you could give 1,000,000 grams. Let's give 1,000,000 grams of drug X and 1,000,000 grams of drug Y. I mean, that'd be gross negligence. However, this is just proving our effect. We're giving the maximum dose of the drug. We're flooding the body with that drug. Drug X only relieves pain to a scale of about 5. People still have pain. I mean, over here, they still have pain. You relieved it a little bit. You didn't get rid of the pain completely. You relieved their pain to a scale of about 5. However, drug Y, on the other hand, the patient really didn't get much relief. You know, you gave them a whole bunch of this pain medicine, but they're still really hurting. They're in pretty bad pain. Which drug is more efficient? Efficiency would go to drug X. You gave its maximum dose, and it lowered the maximal effect of the drug, lowered pain the best. It was the most efficient. So that's the difference between potency and efficiency. Efficiency is the maximum effect of the drug, while potency will be how much drug is required to actually get an effect. And then lastly, we'll bring it home with a talk about effective dosing, lethal dosing, and toxic dosing, and then go to the therapeutic index. So we've got ED50. No, ED doesn't stand for erection disorder. It stands for effective dose. And what does the little sub 50 mean? Well, all of these sub 50s stand for the same thing, so I'll cover that in just a second. So we'll cover these 3 concepts. We'll cover the toxic dose and then the lethal. So ED50, it stands for you give 100 patients this drug, and we're trying to figure out what the effective dose is for 50% of the patients to get that effect. So let's continue with our pain relief. You have 100 patients with pain. What dose is required? And you're going to test these doses in all the different patients. What dose is required for 50% of your patients to be free of pain? You're trying to figure out what the dose, the effective doses, what the dose required for 50% of your patient population to respond by. And our example is pain relief. It could be anything. For our patients to respond to that drug. For it to be effective, for that drug to be effective. Likewise, let's talk about the lethal dose 50. What dose of a drug is required to kill 50% of the patients that take it? So let's say the lethal dose 50 is 100. If our lethal dose 50 is 100, we give 100 patients 100 grams of this drug. It means only 50 will still be alive theoretically. This is all theoretical stuff. Typically tested on animal models. This doesn't happen on humans. We don't give 100 humans dosing of drug and try and figure out what percent do 50% die. No, that's unethical. This is typically figured out on animal models or mathematically. That's all above my head. What's important to note is lethal dose, 50% of patients die at this dose. And then also the toxic dose is going to be 50% of patients will receive some sort of toxic or adverse effect. Adverse. So like a side effect, or they build up a toxic metabolite, they get sick. At what percent? 50% of people get sick. There's a thing called therapeutic index, also known as TI, the therapeutic index. Now what the therapeutic index is, it's going to be showing the safety of a drug. Now the therapeutic index is going to be calculated using our ED50 and our TD50. So the toxic dose, 50, divided by our effective dose, 50. This is going to give us our therapeutic index. This is going to be safety of drug. We're never going to give a lethal dose of a drug. That's just bad medicine. However, we may give a toxic dose of a drug if it's going to help our patient, but that's something else. We want to find drugs that have a high therapeutic index. And what that simply means is it's going to have a high ratio of our toxic dose 50 to our effective dose 50. Now, I'm going to say high TI is fly. A high TI is fly. That's how I remember this. You want a high therapeutic index. A high TI is excellent. So if a drug has a high TI, then that drug is fly. Why do I say it's the safety of a drug? Well, if you have an incredibly high toxic dose 50, if it takes 30 grams of that drug to give you that toxic dose 50. However, this effective dose, if a drug works at, let's say, 1 gram, if you give a patient 1 gram of this drug and it works, great. But if you give them 30, 50% get sick, that'll give you a 30 ratio of therapeutic index of 30. However, now let's change it so that way, let me see if I can find some room. I'll work up here. So now we're going to say that the toxic dose is 10. If you give a patient 10 grams of this drug, they'll get sick. However, for it to be effective, you need to give, let's say 5 grams. You need to give 5 grams of this drug to be even effective. Otherwise, if you don't give 5 grams of this drug, you won't relieve the patient's pain or you won't do whatever else. Your therapeutic index is going to be 2, meaning it's not going to be as safe. Over here, if you go a little above the effective dose, I mean, you're still not reaching toxic levels, you'll be safe. This drug will be safe. However, here, to be effective, you have to give at least 5. However, if you get near 10, you'll start getting these adverse toxic effects, meaning the ratio is a lot less, so you're going to be a lot less safe. So if you accidentally overdose the patient, you're going to have a higher chance of getting toxic adverse effects. So this will be a low therapeutic index. This will be a high therapeutic index. You want a high therapeutic index. A high TI is fly. That's it for my lecture regarding the pharmacodynamics. Hopefully you've paid attention since pharmacokinetics. We've gone on quite the journey. You can unbuckle your seatbelts at this point because we're done. And you're probably sick of me, but this is pharmacology in a nutshell. If you remember what I've said today, if you've spent the last hour or so with me, then you will get a lot of points on your test. If you pay attention to these key concepts in pharmacology, you'll understand it better. And hopefully I've gone through enough. I'm just going to scan through one last time. Hopefully you've understood competitors. This graph is pretty scary looking when you first begin. However, if you break it down, if you look at the Vmax, if you look at the Km, remember that it's a reciprocal. And if you do that, you can figure out if it's a non-competitive inhibitor. You can figure out if it's a competitive inhibitor. We've gone through the Michaelis-Menten plot. The Michaelis-Menten plot this is the heart, this is the backbone of the pharmacodynamic lecture. Because the Lineweaver-Burk was simply just a reciprocal, this is where the money is. This is the high-yield stuff. Remember it. So if you have any questions, be sure to ask. There was a lot of information. However, this is all excellent information. I can't give you a high yield. You should know this part for this lecture because it is all high yield. All the stuff that I talked about will be a test question, no matter what level you're at. If you liked it, please click like. I always enjoy getting likes. I also enjoy getting comments. I love hearing comments from users. If you want more great videos, please subscribe. Otherwise, thank you very much for following along on this journey with me.